Very well known that patients after a mastectomy with no lymph nodes involved really don't benefit from the addition of radiation. There are certain circumstances, very high risk, or maybe a positive margin that could be considered. But typically after a mastectomy for an early stage tumor, there's no additional benefit to radiation. It's also very clear that for patients with 4 or more nodes positive, that adding radiation provides a significant benefit in terms of local recurrence and overall survival. The data on the patients with 1 to 3 lymph nodes positive has been a bit more difficult to obtain. Although it's trended over time with the patients with any lymph nodes positive, so leaning towards the 4 or more positive group, it's a bit more of a heterogeneous group of women. You could have a patient who had 1 lymph node involved, it only had 3 millimeters of disease, 15 lymph nodes were removed, or you could have a patient who had 3 lymph nodes involved, but 5 were removed and they were 2.5 centimeters in size. And the risk-benefit ratio for those 2 patients is likely to be very different. And so this really provides a guide for the patients and for the physicians to help make a decision and a determination in terms of a recommendation for which patients would be most likely to benefit from the addition of radiation.